Hello, my name is James Cosson. I'm a post-op gastric bypass patient, 16 months out, patient of Dr. Jeffrey Lord. My pre-surgery weight was 352 pounds. Currently, I'm 190 pounds. Before I had the surgery, my concerns were if I stayed at that weight, 352 pounds, that I would eventually develop high blood pressure, diabetes, so on and so forth. My main concern was my weight. I was ready to lose weight. Diets didn't work for me, and I thought it was a good option. The defining moment when I basically decided to start thinking about having a gastric bypass surgery was I had a gastric doctor that I would go to every couple of years and have an endoscopy done because I had, reflux disease, and it was just getting to be a real pain, with heartburn and overeating and just different things. My gastroenterologist recommended Dr. Lord, which kind of put the thought in my head, and I started researching and came to the conclusion that Dr. Lord was the surgeon to have. After you have the surgery, you have your typical soreness from having surgery like any other. You heal up pretty quick thereafter. And, the first few months are tough because you have to eat right. You have to change your eating habits. And, that goes back to wanting to have surgery. That was one of the main reasons that I wanted to go forward with the surgery, was I needed to learn how to eat differently, and that was you've got to eat right. You have to watch sugar and fatty stuff, and it I don't want to say forces you to eat better, but you do. You learn to eat right.
He had to make himself eat the first 6 months. It was very hard. He didn't have appetite. So that was.
You have to remind yourself.
Yes.
Yeah, for a while you don't get hungry. You don't have an appetite. So you have to kind of look at your watch and remind yourself. I need to, I need to drink some protein, or I need to, eat some yogurt, or what have you.
Drink some water. The first 6 months were very tough. They were tough on both of us. Probably more tough on him because he was going through it. But he had a hard time taking in fluids because he'd get full very fast. So I was constantly trying to make sure that he was getting his water intake. Shopping, that was different because he had certain foods at different stages after his surgery that he could eat. And I'm used to going and buying him noodles and, candy, junk food and stuff, and so it was tough going out to eat. The first 6 months, I would sneak and go out to eat because he couldn't go out to eat because he couldn't eat anything. And then if he did go out to eat, he would just sit there and watch me, and I didn't want to do that. So it was pretty tough on him.
Tough for a little while, yeah. 5 or 6 months after the surgery, you don't want to eat, or things bother you a little bit. And as time goes on, they bother you much less. And I really don't have many problems now. And honestly, 16 months, I've never thrown up. So I don't. A lot of people might have that issue. I don't. I haven't. And the single most largest problem, I guess, that I've had is drinking enough fluid, drinking enough water. You have to stay on yourself about it. And they tell you to carry a bottle of water around with you. You have to. You have to. Usually when somebody sees me, I've got a bottle. We go riding on the motorcycle. I bought a special, vacuum sealed bottle so it'll be cold. I don't like to drink water if it's not cold, and you have to have it with you all the time.
We've both kind of changed our eating habits too because of this, because you don't want to
sweet.
buy stuff that he can't eat or bring stuff home that he can't eat. So, it's caused both of us to change our eating habits. He used to drink a lot of Coke. He can't drink Coke obviously anymore. So,
a lot of people that I know that have had the surgery, they say the same thing about your taste change. After you have the surgery, it's kind of a clean slate. You're eating all over again. You're learning how to eat all over again. Foods that you didn't like before, you like. I used to hate yogurt. I eat yogurt all the time now. I love it. Your tastes definitely change, and I think you tend to eat things that are better for you. And people think that they can't eat different types of food after the surgery, and there's a couple things that bother me. I still eat them sometimes. Sometimes they bother me, sometimes they don't. But all in all, I can eat just about anything. You just have to watch how much sugar you eat, and very little. Just portions. You have to monitor yourself, and having surgery, you learn to monitor yourself better. One of the benefits is I've learned to eat better.
and he loves to shop.
I can go anywhere and find clothes. And people that are 352 pounds, you can't just go anywhere and find a pair of pants or a shirt that you like, and that's why it's become one of my favorite things, because I can just walk in anywhere and find something that I like. I'm more active. I do a lot more things. A few months ago, I bought a Harley. We ride all the time, so I get out and go a lot more. I used to. I would, when you think about running out to the store to grab a few things, or I used to. I probably would, wouldn't think about it a second time. I would just maybe stay on the couch and not get up and go. And now I'd rather get up and go.
Our life has changed. We actually, since he's had the surgery, we actually spend a lot more time together instead of us doing our separate things, because, as I said before, I like to be outside, and now he's outside with me. We have grandchildren. He's more active with our grandchildren instead of just sitting on the couch when they come over.
Yeah, we basically just go and do more, and we go out of town, vacations or little trips, quite a bit more than we used to.
He doesn't have the aches and pains like he used to, so now we both get up and go. And I don't have to shop for myself anymore, because he shops a lot, so he just goes and buys my stuff.
I do. Yeah,
He does.
I
hate
things
shopping.
for her as well.
So we go out to eat now. It's actually cheaper on us because we usually we order something and share it, because we both aren't big eaters, so we'll share something. And it's
I work
a lot
out
cheaper.
I work out in the field I'm a technician, and I work with a bunch of guys, and 23 years I've been doing this, and we eat lunch out every day. And honestly, that was a concern. before I had the surgery, am I going to be able to hang out with my buddies and eat lunch? And I go to lunch every day still. I usually
just order smaller portions.
I usually take a to-go box, you know, and come home and put it in the fridge or eat it for dinner. But, you know, it works.
Well, we've always had a good sex life, but our sex life, it's like we're teenagers again, because he's more active, you know, and can, I don't know what else to say.
More flexible.
More flexible. God, the first 6 months I wanted to kill him. I'm like, what did this doctor give you? Because you're like a bunny rabbit. You know,
And other people that I've talked to who've had surgery say the same thing.
They actually ask, how's your sex life? And I'm like, why do people ask that?
People know.
Yeah.
Especially people that have had the surgery. And, yeah, first, you know, 6, 8, 10 months are just like a crazy person. And then, you know, and of course it slows down a little bit, but it's still crazy. So it's wonderful.
Yep.
I would definitely recommend the surgery to anyone, you know, thinking about having it. It's a life-changing surgery. So I've lost a total of 162 pounds.